Let's start today's seminar. I will talk about associated or related conditions of the Nutcracker syndrome. Okay, if we summarize about Nutcracker is increasingly recognized as a more common condition than we previously thought, and formation of collateral venous pathways can produce a broad spectrum of symptoms, which are typically more pronounced on and often confined to the left side of the body. And I also mentioned that Nutcracker syndrome and Nutcracker phenomenon the meaning is different. Phenomenon is phenomenon, and syndrome is a phenomenon plus symptoms caused by this phenomenon. This term, midline congestion syndrome, is a diagnostic term describing a severe form of Nutcracker syndrome characterized by various left-sided symptoms resulting from venous congestion of the left half of the body caused by collateral venous drainage from the left renal vein. So midline congestion syndrome is a form of Nutcracker syndrome. As a associated condition to Nutcracker syndrome, one we often see is a May-Turner. May-Turner is the name of the physician describing this syndrome, May-Turner syndrome, which is caused by compression of the left common iliac vein by right common iliac artery. Also, this May-Turner syndrome is different from May-Turner phenomenon. This is a May-Turner phenomenon, is just compression phenomenon. As May-Turner syndrome is a syndrome that has a symptom caused by this May-Turner phenomenon. Another well-known syndrome is the superior mesenteric artery syndrome. It's a rare, potentially serious digestive disorder where the third part of duodenum is compressed between the aorta and the superior mesenteric artery, causing partial bowel obstruction. Also has the terminology superior mesenteric syndrome and the superior mesenteric artery phenomenon. Another thing is the median arcuate ligament syndrome, is another form of vascular compression syndrome in which celiac artery is compressed by the median arcuate ligament. Also has a terminology median arcuate ligament syndrome and the median arcuate ligament phenomenon. So I will talk about these things. Let's start with the midline congestion syndrome. As I said, this is a form of Nutcracker syndrome with a symptom mainly limited to the left half of the body and is caused by the venous collateral channels, developing venous collateral channels on the left side. I think the venous channel in our body is all connected, and there are a lot of the midline crossing venous channels around the vertebra and in the pelvic cavity areas. If these midline crossing venous channels are well developed, usually this midline congestion syndrome does not occur. But in patients whose midline crossing venous channels are not developed well, usually venous congestion is limited to the left half of the body from the head to toe, and the symptom, if the patient has this symptom limited to the left side of the body, we call this a midline congestion syndrome. The typical example of midline congestion syndrome include left-sided pelvic congestion in women and the left-sided varicocele in men. However, venous congestion may occur anywhere from the head to toe and cause a variety of left-sided symptoms, such as pain or discomfort in some unusual area, and edema, numbness, tingling sensation, headache, nasal stuffiness, tinnitus, and conjunctivitis, etc. This is a 54-year-old woman with Nutcracker syndrome and midline congestion syndrome. She had a whole left body aches and also had a pulsating tinnitus in left ear and left leg pain. Had the nutcracker here is a compression between two aorta and superior artery and the sluggish flow here, and had a left pelvic congestion. And this is a CT scan showing the nutcracker, and also CT scan shows a severe pelvic congestion. Because this patient's symptoms are usually mainly limited to the left side, we may call this patient has a midline congestion syndrome. The May-Turner syndrome, as I said, this is caused by compression of the left common iliac vein between the right common iliac artery and the vertebral body. So the right common iliac artery in front, and this is a compressed left common iliac vein, and this is a vertebra. So May-Turner syndrome presents as a left leg pain edema, or in some cases, deep vein thrombosis. And May-Turner syndrome frequently coexist in patients with Nutcracker syndrome. So I usually, when I'm doing Doppler ultrasound from Nutcracker, I usually ask the patient if they had a left leg symptom, and if the patient has, I usually examine the left common iliac vein also. Sometimes I can see some compression, but no symptoms, then I call it the May-Turner phenomenon. And if the patient has some symptom on the left leg, I call it the May-Turner syndrome. CT and MRI can visualize the venous narrowing, and this is CT scan. This is the right common iliac artery. This is a compressed left common iliac vein, and color Doppler ultrasound is usually is the first line started to reveal narrow vein and post-stenotic turbulence, and sometimes venous thrombosis. In this patient, this is a right common iliac artery. This is a compressed left common iliac vein, and the red colored slow flow is changed to the bright colored fast flow here. And in this patient, there is a echogenic lesion in front of the left common, in the anterior wall of the compressed left common iliac vein, and we call it a venous spur, which is fibrous band or sharp that forms within the left common iliac vein due to chronic pulsatile compression by the overriding right common iliac artery. So in May-Turner patients, we often see this echogenic thickening of the anterior wall of the left common iliac vein caused by chronic pulsatile compression. This is a 69-year-old woman with a nutcracker and May-Turner. This patient had the bladder symptoms like foamy urine, nocturia, and the left leg edema. And this is a left renal vein in grayscale and color Doppler. We see the bright colored jetting, and so had a nutcracker phenomenon, and heads because the symptoms, this is we can call it nutcracker syndrome. And this is a left common iliac vein, and right common iliac artery is compression here. As we see in the previous case, we see echogenic thickening of the anterior wall of the compressed left common iliac vein. We call it a venous spur, and also at color Doppler ultrasound, bright jetting. As different thing in when we examine the common iliac vein, it is very hard to measure the flow velocity because the of the Doppler angle. As I said, when we examine the left renal vein, we rotate the transducer a little bit counterclockwise and can make the angle, Doppler angle, better. But in common iliac vein, it is not easy to make a the optimal Doppler angle to measure the flow velocity. So we usually observe these compression and compression effect using color Doppler ultrasound. 44-year-old woman with Nutcracker, and this patient also has a midline congestion syndrome, and symptom was numbness of the left arm and leg, left flank pain. So symptoms were limited to the left side. So this patient has a midline congestion syndrome and had a bladder symptoms, and the left also had a left leg symptom, and I examined the left common iliac vein also. And this is left renal vein, and we see the jetting phenomenon here and the sluggish flow here, and also had a left pelvic congestion. CT scan also shows a jetting phenomenon here. And this was the left common iliac vein compressed by the right common iliac artery. And there's a bright colored fast flow here, and indicating the compression May-Turner phenomenon. And this is CT scan, and left common iliac vein is compressed by right common iliac artery. And I said that the fast flow in this compressed area, the contrast opacified left renal vein flow, is the flows along the non-dependent anterior wall of the inferior vena cava. Similarly, in this patient in the left common iliac vein, some contrast opacification occurred here, and the contrast opacified flows along the anterior wall of the left common iliac vein. A similar phenomenon happens in this left common iliac vein and the left renal vein. 61-year woman, Nutcracker and May-Turner, she had a back pain, had voiding, and had a nocturia. And clearly there is a Nutcracker phenomenon here in ultrasound and also in CT scan. And this is the left common iliac vein and right common iliac artery. I tried to rotate the transducer, making the Doppler angle better, but this is all I can do. But at color Doppler ultrasound, we can recognize that color changes in this compressed area as a bright yellow color. So it means that the velocity in this area is different from in these areas. And we can say there is a compression phenomenon, but May-Turner phenomenon occurs here. And this is a CT scan showing some compression. 39-year-old woman with Nutcracker and May-Turner had a general body aches following cesarean delivery. And this is Nutcracker as CT scan, and this is a May-Turner phenomenon at CT scan. And with the patient postural changes, this is a left renal vein, and there's no supine in the left lateral decubitus and the right lateral decubitus. As we discussed, left lateral decubitus, the compression is least and is the best position for sleeping position for the Nutcracker patients. And interestingly, also in May-Turner, the same patient, and common iliac vein as supine, left lateral decubitus, and the right lateral decubitus. Also, the compression, the phenomenon in left common iliac vein is also most severe as supine posture and is least severe at left lateral decubitus posture. So if the patient has a left lateral decubitus posture during sleeping, say a least compression of the left renal vein and least compression at left common iliac vein also. Old woman with Nutcracker and midline congestion syndrome and May-Turner syndrome, and had a vague discomfort in left abdomen and the left leg. Also, the symptoms are usually on the left side, and this is Nutcracker Doppler and the Nutcracker SCT, and this is the compression of the left common iliac vein, so May-Turner phenomenon at Doppler ultrasound and also a CT scan. 61-year-old woman is this patient has a Nutcracker. It has a symptom of the face and leg edema, very vague symptoms. But this patient has a CT scan. The left renal vein is there is an anomalous left renal vein running posterior to the abdominal aorta between the vertebra and the aorta. So we call, and there's some compression effect here. So we call it the posterior nutcracker. And this patient had also had the compression of the left common iliac vein and the echogenic thickening of the anterior common iliac vein wall. Is a venous spur is there, and the fast flow is there, and very sluggish flow, no color signal in this left part of the left common iliac vein. So quite severe, the May-Turner phenomenon occurring here and may cause left leg edema. And we do not know the cause of face edema, but maybe related to the collateral venous pathway, collateral venous, the congestion of the collateral vessels in the facial area. I just said the superior mesenteric artery syndrome is a compression of the third portion of duodenum between the aorta and the superior mesenteric artery, causing a distension of the stomach and the proximal duodenum, and causing severe postprandial abdominal pain and nausea, vomiting. But I have never seen the patient has both Nutcracker syndrome, typical Nutcracker syndrome and typical superior mesenteric artery syndrome. So it's a rarely co-occur. But phenomenon, compression phenomenon occurs in the same area between the aorta and the superior mesenteric artery in Nutcracker and the superior mesenteric artery syndrome. This is a typical example of the superior mesenteric artery syndrome, compression of the third portion of duodenum between the abdominal aorta and the superior mesenteric artery, and distension of the stomach and proximal duodenum. The median arcuate syndrome, as I said, this is a celiac vessel is compressed by the median arcuate ligament. This median arcuate ligament is continuous with the diaphragmatic cruise, and this is forming the front of the aortic hiatus at the level of T12 and L1 vertebral level. And this if the ligament is positioned too low, it can compress the celiac artery, and it is also called the celiac artery compression syndrome. Or it may cause surrounding nerves, and we call it the median arcuate ligament syndrome. And this median arcuate ligament syndrome, the sometimes they coexist with the Nutcracker syndrome. It has a Doppler criteria, so if the maximum flow at the proximal ciliary artery exceeds 200 centimeter per second, this is the Doppler diagnostic criteria. And open contrast enhanced CT scan in sagittal plane like this, we can see the compression of the proximal part of the celiac artery by the ligament structure. This is the median arcuate ligament, and it is compressed by the lower lying, this ligament, proximal celiac artery area is compressed. Young woman had the bladder symptoms and did not have any stomach symptoms, but had the compression phenomenon here, so we can call this median arcuate ligament phenomenon. Has a nutcracker here, grayscale and color Doppler, and this is a peak flow velocity, and had a pelvic congestion. And this is sagittal plane ultrasound of the abdominal aorta, and this is superior major artery, and this is left renal vein, and this is a celiac artery. And with the patient respiration, you can see some compression effect occurs here due to this hypoechoic linear structure. Probably that is a median arcuate ligament, and the compression occurs in proximal area of the celiac artery, and the very bright colored flow here in celiac artery. And the peak flow velocity was 228. So that criteria was 200. So we can say this patient has the compression effect at the celiac artery origin by the median arcuate ligament, but did not have a symptom. So this is just a phenomenon. Another patient, this patient had a nutcracker and also had the median arcuate ligament compression, the phenomenon, but did not have any symptoms. Very severe, the compression of the left renal vein and dilated left renal vein, and bright colored jetting, 170 flow velocity. This is the aorta. This is the celiac artery, and the very bright colored flow. Velocity is high, 237. And the CT scan also shows a little bit compression here. So this patient has the compression phenomenon in celiac artery, but did not have any symptoms in this patient. Also, this is a young woman, and with the different postures, supine, left lateral decubitus, and the right lateral decubitus. This is a left renal vein area, so nutcracker area. Supine 142, left lateral decubitus 36, and the right lateral decubitus 87. The compression relieved the left lateral decubitus. This is the celiac artery area. Also, this similar difference exists, and the highest flow velocity is supine, and the similar low flow velocity and right and left lateral decubitus. A few other things we can consider is a so-called orthostatic proteinuria. This is a benign, often temporary condition in children and young adults when protein is present in urine only while standing or upright, but normal while lying down supine. It is usually harmless, asymptomatic, and resolved by adulthood, requiring only monitoring, not active treatment. It is often considered an exaggerated physiological response to upright posture, and potentially due to elevated angiotensin 2 and noradrenaline, or a variant of normal renal hemodynamics. So it is the cause is not exactly known, but maybe compression of the left renal vein when the patient is standing. And sometimes in some cases, if we examine the left renal vein in patients with orthostatic proteinuria, uh, if we examine the left renal vein, sometimes we can find the Nutcracker phenomenon. So it may be related to Nutcracker syndrome in some patients. Another the symptom categories postural orthostatic tachycardia syndrome, so-called POTS. Is the Nutcracker syndrome also can cause or contribute to these symptoms. This is a patient who is a form of dysautonomia, is a disorder of the autonomic nervous system characterized by tachycardia upon standing, and symptoms include dizziness, fainting, severe fatigue, and brain fog, often triggered by a lack of blood flow to the brain. It primarily affects the young woman, often following viral illness or pregnancy, and the management is a lifestyle adjustment like increased salt intake, hydration, compression, garments, and exercise. But causes it is sort of form of a dysautonomia syndrome, but Nutcracker syndrome can cause or contribute to these symptoms also. The last thing I would like to say I'm interested is the Ehlers-Danlos syndrome. It is quite common in the Western countries, but not uh, we do not see many patients, Ehlers-Danlos patients in Korea. I don't know, it's the Taiwan or Vietnam. So, but I think this Ehlers-Danlos syndrome is related to the Nutcracker syndrome. In the Western country areas, a lot of description is a Nutcracker syndrome is related to this Ehlers-Danlos syndrome. It's a group of inherited genetic disorders affecting collagen tissue, resulting in weak connective tissue. So at least 14 known subtypes exist. The hypermobile Ehlers-Danlos syndrome is being the most common, and vascular Ehlers-Danlos syndrome being the most severe. It's frequently linked to the connective tissue fragility as causing vascular laxity, which can lead to the compression of the left renal vein between the two arteries. EDS causes weakness of tissue supporting internal organs, potentially leading to hypermobile kidneys or nephrotosis, potentially triggering chronic pain or vascular complications or urinary issues. One case, I think this patient probably have Ehlers, not confirmed, but probably have a Ehlers-Danlos syndrome. Is a 55-year-old woman, Nutcracker with microhematuria and nocturia, and typical Nutcracker here, and peak velocity like this, and pelvic congestion. When I see this patient, the right kidney, with the patient's respiration, moving from here to there, a lot of the moving range, very wide moving range of the right kidney with patient respiration, probably related to the very lax connective tissue supporting the right kidney. So hypermobile kidney, mobile right kidney in this patient, and this is the figure showing the Ehlers-Danlos syndrome, like the the elastic the skin and subcutaneous tissues and the hyper flexible fingers and arms. So when I see this kind of hypermobile kidney, I ask the patient to the hyperextend his or her fingers, but I did not see any confirmed case Ehlers-Danlos syndrome in Korea, but maybe this Ehlers-Danlos syndrome is also associated with Nutcracker syndrome.